Welcome back to Great Day. So as we age, you may have noticed our skin starts to lose its bounce and things can begin to sag, but that doesn't mean you have to settle for it. There are several non-surgical options before you get to a facelift to boost your look, but our next guest can do all of that too. Joining us with various ways to get your groove back is Dr. Paul Fortes from the Aesthetic Center for Plastic Surgery, also known as ACPS, and aesthetic nurse Heidi from ACPS MedSpa. Hello there.
Hi, how are you, Deborah?
I'm doing well. All right, I'm going to start with the fact that, by the way, I always love seeing plastic surgeons because I saw you staring. You were staring. You were staring. Yeah, both of you were staring.
You look great.
We'll talk after the show. All right. You are double board certified. It is important when you're going to meet with somebody who is dealing with your face, your looks, your body, to know what their background is and their expertise is.
Absolutely. I mean, board certification just means that you've achieved a very high standard in your field.
Yeah.
And so I'm board certified in plastic surgery and general surgery, and so that I bring that to my practice.
Yeah.
And now I bring experience.
Yeah,
so that's
exactly.
the next layer.
All right. Heidi, you worked as a neonatal intensive care nurse.
I did, yes.
Yeah, a lot of pressure there, but now in the aesthetic nursing area, you are a certified master injector. Tell people what that means.
Right, so I have been injecting for about 18 years. I'm actually a national trainer for both Galderma and Revance. So I've had extensive training in the injectables. In general.
Things like to fill out our faces and get rid of wrinkles and all that type of stuff.
Yes.
Yeah, because you want to make sure someone knows what they're doing there as well. And when it comes to the med spa area, there's all kinds of things that people might not have been thinking about. One of those is cellulite treatments, as we call it, hair damage, right?
Right. Yeah. There's all sorts of things that we can do now.
Yeah, hair rejuvenation, injectables for wrinkles and volume. We know about that. Laser treatments, microneedling, skin tightening, all those types of things that you can do at the med spa. But when it comes to facial procedures, just like technology and anything, that's a wider field now. It used to be you got the full meal deal, the facelift. You can do parts of the face, the areas that's just a problem area, and sometimes you have just one problem. For example, you can contour, add or decrease volume with skin when you're dealing with fat, for example. A lot of people have lost a lot of weight because of things like Ozempic.
Sure.
And it looks great on the body, but the face suffers.
Right, exactly. You know, Heidi does procedures and treatments in the spa setting, and I do big surgery. But sometimes people don't have time for big surgery and big recovery. So one of the sort of in-between options that I offer are smaller procedures that can be done under local anesthesia in an office setting. Much quicker recovery, less downtime, but just because they're smaller procedures doesn't mean that they aren't impactful. As a matter of fact, you know, you can get beautiful results from an eyelid lift or adding a little fat to the face, and it can be any place where a person, as you said, has lost volume in their face.
Well, let's talk about specific areas too. So sometimes it's just one area of your face that's bothering you. Okay, so chin liposuction. Why would someone do chin liposuction?
It's to get rid of that sort of genetic fat that's kind of stubborn, that doesn't go away regardless of what your weight may be. It's not something that necessarily is with overweight people. It could be in people who are normal weight, but may have the accumulation of fat that really is not flattering. It creates a poor contour, and it also sort of blunts the lower part of the face and the jawline. So doing liposuction to get rid of that fat just brings out
look
beauty.
At that, much more streamlined jawline right there.
The beauty in the neck and the jawline. And in young people in particular, it's an awesome operation because it almost looks like they've had a facelift. And they have it.
And you can't exercise that fat away.
No.
The upper blepharoplasty, which is the eyelids. Sometimes people have, whether it's genetics.
Eyelid lift.
Yeah, eyelid lift. Let me just say that. Yeah, whether it's genetics or just with the age, and you can just widen the eye.
Right, exactly. And you know, young people and older people are maybe good candidates for this operation because it really opens up the eyes, so you can remove a little strip of skin and the incision line is hidden in the crease, so when your eyes are open you don't even see where the incision was placed. It literally opens up the eye, makes it look so much better. And I had a patient who was also an employee of mine who had these procedures. She had the blepharoplasty, the eyelid lift, and the liposuction of the neck on a Thursday afternoon. And by Monday, she was back at the office.
Oh, she was showing off to everybody.
Off.
Yeah, right. All right. You know, we spend so much time trying to lose weight. I'm going to go back to something you said earlier about like putting fat in the face. But there's a time when that's good because when you lose volume, it can make you look older.
Right.
So fat grafting in particular, we've seen it in certain other areas of the body. Sometimes people, instead of doing breast implants, wanted to add the fat. So when you do it in the face, tell us who's a good candidate for that and what that procedure looks like?
Well, it's a natural and a more permanent way of restoring volume because we lose the volume in the face as a consequence of weight loss. And you mentioned Ozempic and these kinds of drugs that do that these days, and people are losing a lot of weight, but they're also losing weight in their face.
Even
and
gastric bypass, right? With getting a lot of weight loss,
which doesn't make them look good. It makes them look older or maybe less healthy, or just as a consequence of aging. So what do? We replace like with like. So I do mini or micro liposuction in there. You get a few teaspoons of fat, process it, and inject it into the areas.
And it's your own fat, so
it's your own fat. It is your own fat. And once it sets up shop where we inject it, it's there forever.
Yeah. All right. And recovery time, as you mentioned, that could be very quick. Okay, face fillers and Botox. Those are things that you can do in between. This is why there's so many options. This is why it's great to come in and have that consultation, because you can look at someone and say, yeah, we can get that done with fillers and Botox versus having to do surgery.
Yeah, definitely. There's a lot of options, and we work together as well. So, there's times where a patient may come in and they have a specific event that they're wanting to get ready for, and so they may not have the time to go in for surgery or even have an in-office procedure, and we can do things that will give them a more immediate result for their event, and then they can follow up with the doctors and do something that's going to be more permanent.
Yeah, and you can talk them through it. Somebody wants fuller lips, you can talk them through that. They're like, I don't want to look like Kim Kardashian. Well, if you're going to the right person, you probably won't, unless you really want to, right?
You stole my thunder, because I was going to say that Heidi and I work closely together. If there are patients who come in and want an immediate improvement, but they don't have the downtime, and they are a good candidate for filler or Botox or these sorts of treatments that Heidi offers, they'll go to Heidi. And if they are interested in having bigger surgery, then they come to me.
And sometimes when you get the fillers and the things like that, you can get an idea of what it would look like if you did that bigger surgery, right? So you can try before you buy, if you will. There's a thing called biostimulators. What are those?
Yeah, so biostimulators are things like Sculptra or Radius that we inject that activates new collagen and elastin formation. So your body's creating its own collagen and elastin. So they become very popular, especially with this weight loss, because they're losing so much weight, and it gives us a gradual improvement. So we can, get some subtle changes over time, but it improves the quality of the skin, the texture of the skin. So it really just is a beautiful, beautiful result.
You can actually time that to where if you know you're going to be losing that weight, to go in and get that done. And so that process has already started. Looking at some of the patients that you've had, Sherry, she had the filler, Dysport, and Clear and Brilliant, and the BBL. So there's combinations of things. Again, the importance of the consultation.
Yeah, and it's not just one thing, and that's another thing. For patients to understand is that we want to treat the skin and the face as a whole, and we need to look at like laser treatments and other procedures that are going to improve the quality of the skin.
Yeah, because you get the best skin possible, make that your foundation that you're working with, right? And then you have another patient here, had Botox or Daxify, filler, Sculptra, and Ultherapy. So got the different, look at that. I mean, it just, and the thing is, it looks natural. That's the other thing. It just took years off without looking like, she just looked like she had a really good vacation.
I know.
Yeah, and the point with this photo was that she has done a number of things over time to achieve these results. So sometimes, just helping patients understand what we can do and what they can do to take care of their skin, and it does look very, very natural, and she's very happy. She looks great.
Reverse aging, that's what it is. All right. Other plastic surgery services you have, breast augmentation, you mentioned facelifts, but even if you want to do the whole mommy makeover, so the tummy tuck and the whole bit, so head to toe, whatever we need to make us feel comfortable. You do it all.
I do it all.
And we can get it all done. Okay, you're staring at me again. Okay. Thank you too very much. If you're ready to book your consultation today, Dr. Fortes has two special offers. Take $500 off an upper blepharoplasty or receive a fat grafting to the face or chin lipo procedure for $4,000 until October 31st. To schedule your consultation, give Dr. Fortes a call at this number at 713-799-9999. Again, that's 713-799-9999, or visit their website, fortesmd.com. Now, ACPS MedSpa is also offering several promotions. Purchase 2 vials of Sculptra and Radius and get 1 for free, or receive receive 15% off Ultherapy. To schedule a consultation there, give them a call. Again, the number is 713-799-9999. I have that number memorized. Or visit their website at acpsmedspa.com. All right, if I come in, can I get that body right there? I want her body. Yeah, I want hers. Okay.